Greetings from IMA CGP headquarters. In this video series, we are going to see about obstructive sleep apnea, which is a very enigmatic condition and a widespread condition in our population. So it is important for family practitioners to be aware of this condition, its manifestation, and its diagnostic and treatment procedures. I am Dr. Shaktesh, Director, Nose, Snore and Hopkins Clinic, Chennai, Tambram. So, imagine your life if you are allowed to sleep only for 2 to 3 hours per day and you have to live with that for the rest of your life. That is how life feels for a patient who is suffering from severe obstructive sleep apnea syndrome. So you can all imagine the consequences of chronic lack of sleep to that extent. So that is what this obstructive sleep apnea can do to a person. So, obstructive sleep apnea is not that rare condition. Traditionally, the European and American studies have revealed a prevalence of about 12 to 15% in adult population. Recently, we have had a study by AIIMS Bhopal, which has revealed that almost 32.5% of average Indian adults suffer from moderate to severe sleep apnea, and most of them are undiagnosed or untreated. So that is a very huge number. We are looking at 1 in 3 adults suffering from obstructive sleep apnea syndrome. So we have much to do in that aspect as family practitioners. And movies have taken note of this condition, and there has been several good movies on this regard. Just to name a few, A Good Night and Dear, movies which have recently revealed, which have portrayed the social impact of this condition in a very vivid manner. So it is important that as doctors we take note of this condition and do something about it. So, and to quote certain studies, and OSA prevalence is supposed to be as high as 40 to 80% in patients with hypertension and cardiovascular conditions. It is cited as the most under-recognized condition in the background of cardiovascular accidents. And in terms of diabetes and metabolic X syndrome, it is said that they have a very close relation. That is, patients with obstructive sleep apnea patients have high prevalence and incidence of diabetes, and diabetic patients are also known to suffer from obstructive sleep apnea. And another important study has revealed that obstructive sleep apnea increases the risk of road traffic accidents by 1.5 to 2 times that of a normal person, which is a huge number. Imagine an obstructive sleep apnea patient being the driver of a bus or a train, and if that person creates a road traffic accidents, imagine the impact it can have on our society. So that is the thing that we have to take into consideration. When you come to sleep related breathing disorders, it is a spectrum of condition in which obstructive sleep apnea is included. It is a condition where the upper airway technically starts from the nose and comes up to the start of the windpipe or the trachea. So this upper airway is the site of origin of obstructive sleep apnea. In patients who suffer from obstructive sleep apnea, the upper airway can collapse during sleep due to various reasons and varying degrees. So that is the origin of obstructive sleep apnea syndrome. It is seen only in human beings because of the upright posture and the evolutionary changes in the structure of the upper airway, as you can see on the picture. So what happens in an obstructive sleep apnea patient is, when the patient goes to sleep, the patient goes to the N3 level or the deep stage of sleep when the airway completely collapses, which results in what we call as apnea. That is, there is no breathing, the patient is trying to breathe but the air is not coming in. When that happens, ultimately it results in hypoxia. When there is hypoxia, it leads ultimately to arousal. That is, the patient moves from a deeper plane of sleep to a lighter plane of sleep. When that happens, the airway opens again and the patient continues to breathe for some time, the oxygen is corrected, and then the cycle keeps on repeating multiple times during the sleep. That results in the pathogenesis of obstructive sleep apnea syndrome. So there are various reasons why a person's upper airway could collapse during sleep. There has been 4 reasons which have been identified. The number one will be an anatomical causes where there are certain narrowing in the upper airway which results in the obstruction of the upper airway during sleep. And the second common reason is neuromuscular incoordination, that is, you have pharyngeal dilator muscles and you have pharyngeal constrictors muscles. If there is an incoordination between the pharyngeal dilators and pharyngeal constrictor, it can result in airway collapse. And the other two things are a little bit difficult to understand, but they are called as ventilatory loop gain and low arousal threshold. So these are the other reasons, but it is suffice to understand that the airway collapses due to various reasons, which results in the occurrence of obstructive sleep apnea syndrome. So ultimately, when the airway collapses and the patient snores, what is the ultimate result? So it results in two problems basically. One is fragmented sleep and other is chronic sympathetic stimulation. So fragmented sleep meaning whenever the patient goes into a deep sleep, it results in hypoxia which leads on to arousal. If this thing repeats itself multiple number of times, the patient's sleep, particularly the deep sleep, is frequently interrupted, resulting in an affected quality of sleep. So that ultimately makes the person feel that he has not slept enough. It's called as lack of refreshing sleep. He might have slept for 8 hours, but he still feels like he has slept only for 1 or 2 hours. Imagine doing that every night. That ultimately results in a lot of problems. And then you have, every time your airway collapses, it leads on to hypoxia. That hypoxia results in sympathetic stimulation due to a natural physiological mechanism. If that sympathetic stimulation is going to happen every night and throughout the night, that is going to lead on to certain complications. That is the another problem associated with obstructive sleep apnea. So when you come to the symptomatology of obstructive sleep apnea, so the snoring is the most obvious thing, but that's not what patients may come to you for. The patient may present with effects of sleep apnea, like the patient is not being able to sleep properly. So he may come to you with lack of refreshing sleep. He may come to you with lack of concentration. He may come with chronic headaches. So that may be the presenting symptoms, or he may present to you with complications of obstructive sleep apnea. He may come to you with cardiovascular disorders. He may come to you with hypertension. He may come to you with diabetes. He may come to you with obesity. So all these things can be the presenting symptoms. So it is very important as a family practitioner to be aware of the various presentations it can come to you with. So it is important as a family practitioner that you identify and pick up these patients and refer them to specialists so that they are diagnosed and treated properly. So investigations. What happens once you identify and suspect that the patient might be having obstructive sleep apnea syndrome? What you are supposed to do? There are various simple questionnaires available on the internet. To name a few, Epworth Sleepiness Scale, ESS as we call it, or Stop Bang. These are easy questionnaires widely available on the internet. You can ask the patient to fill that and score it. And if you find that the patient has a high degree of suspicion based upon those screening questionnaires, you can probably refer them to an appropriate specialist for evaluation. When they come to a specialist like an ENT surgeon, what generally happens is we do few investigations to kind of diagnose the patient. There are few information that we need. Number one, we need how severe problem the patient has and what is causing the problem. These are basically the main information that we need. For that, we do what is called as a polysomnography, which tells us how much problem the patient is having. And we do what is called as a drug-induced sleep endoscopy, which is basically an endoscopy done after putting the patient to sleep by giving some sedative medicines. So these two are the main investigations that are done for an obstructive sleep apnea patient, and accordingly we kind of quantitatively and qualitatively diagnose the patient, and then treatment is provided for the patient. So when it comes to sleep study or polysomnography, you have very simple devices easily available and accessible, like a level 3 sleep study for which the patient does not go to a sleep lab. The test is done at the patient's home, and which can easily give us an idea about how severe the patient is. And then the sleep endoscopy has to be done in a hospital setup. So when you come to treatments, there are various treatment modalities which are available for the patient these days, and the treatment is now customized. There is no one size fits all treatment for obstructive sleep apnea. We have to exactly know the patient's problem and understand it, and based upon that we have to provide the patient a tailor-made solution for his condition. So various treatment modalities include CPAP, now continuous positive airway pressure, and there are upper airway surgeries which can give relief to certain subset of patients. Then you have oral appliances which can give relief, and then finally you have hypoglossal nerve stimulation, which is basically you implant a electrical sensor to the tongue protrusor muscle, which kind of gives a stimulus which results in the tongue protrusion slightly, which opens up the airway. So these are the various treatment options available, but then it has to be customized depending upon the patient, and we have to decide which treatment will suit the patient more in comparison to the other treatment modalities. So these are the major treatment protocols for obstructive sleep apnea. And finally, to sum up, it is a condition which is widely prevalent in our country, and it can cause a lot of loss in terms of productivity and morbidity. So it is important for every other family practitioner to be aware of this condition and its diagnosis and treatment, and together we can really make a change to our society by treating this condition. Thank you very much.